Hello, everyone. My name is Riley Peterson, and this is my project regarding my joint and movement, the knee while biking. We got a lot of really interesting information to get through, so let's power right through it. So before we get too far into the topic, I just want to introduce the knee. Some fun history. An archaeological dig site in Ethiopia in 1974 unearthed a fossilized skeleton dated to be over 3.2 million years old. The specimen came to be known as Lucy. She was an extinct hominin called an Australopithecine. And on the right image, we can see she displayed several bones, including a pelvis, a femur, and several bone fragments of the lower limb. And something of note here is that when scientists fit the femur and the knee together, it was clear that this was a bipedal individual. So you could ask, well, yeah, human ancestors walked on two legs. What's so significant about that? But what is interesting about and so significant about this find is that it predated all of the fossils that came before by a significant amount of time, recategorizing the timeline of upright walking hominins in our ancestors. All of this exposition is to say that the joint we are discussing today is ancient and defining in our history and how we as a people evaluate and look at skeletal architecture. Looking at Lucy, we can trace our movements back to a very unpredictable time and try to imagine the distance she walked and the danger she evaded with the help of her knee. Lucy's knee serves as a jumping off point to looking at ancient structure, but let's turn and look at the knee today and how it looks in us humans. So jumping into the knee's design, most of us in our field understand that the knee is made up of three bones: the femur, the patella, and the tibia, as seen in the picture to the right. As we understand, bony structure dictates the movement potential at the joint, and the knee is a hinge joint, which allows for flexion and extension in the sagittal plane only. The knee has four main ligaments. These ligaments help stabilize and hold the knee together. These include the anterior cruciate, the posterior cruciate, the medial collateral, and the lateral collateral, all also known as the ACL, the PCL, the MCL, and the LCL respectively. In the knee, you have articular cartilage which surround the ends of the bones and serve the purpose to form a durable sheath, typical of synovial joints, and you can even see it in the image in the small blue highlighted section. And there's also connective tissue discs called the lateral and medial menisci. These serve several functions, but the main one is shock absorption, which is pretty interesting to think about, as the knee withstands so much pressure and weight on a day-to-day basis. Now that we understand the design from the bones, the ligaments, and the cartilage perspective, we now can look at the muscles that actually cross the knee and help move the joint. So there are several muscles that cross the knee joint and work to extend or flex the knee. This is very complex and interesting and something that we'll touch on much more in the muscle activity portion. But just to become familiar with them in general, we have the extensors, or the quadricep group, on the anterior side of the leg. These include the muscles rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. On the posterior side, we have the flexors, or the hamstring group, including semitendinosus, semimembranosus, and biceps femoris. So now that we understand the joint architecture, including the bones and the muscles that make up the knee, we can now start defining the movement and the vocabulary and definitions that the research uses as to better understand going forward what the literature is saying. So a single pedal on a bike is usually referred to as a revolution or a stroke, and this makes up 360 degrees around the entire motion. Further breaking down a stroke, the power, or sometimes called push phase, is from about 12 o'clock to 6 o'clock. This is the phase where most of the force is generated, which will propel the bike forward. This is often called the downstroke as well. The upstroke, or the recovery or traction phase, is the rest of the motion back to 12 o'clock from about 180 degrees on the circle. It's important to understand that a lot of the research differs on this vocabulary and will use slightly different words. but it's usually pretty clear what they're referring to, and anything that deviates from this diction that has been established here, I will clarify. The graph on the right really helps to identify the joint motions of the movement while we're talking about a stroke or revolution, with the x-axis indicating the pedal positioning on its degree, and the y-axis is the joint angle of the knee, of course. So the power phase is, remember, from the very start of the motion to about 6 o'clock, and we can see that the knee is extending to about almost 180 degrees, where it's extended to its maximum. At this point, the knee will begin to flex as we see the joint angle increasing for the remainder of the revolution until another one continues. So you can imagine if you linked a bunch of these together, you would see constant up and down and up and down as someone is continuing to pedal. An interesting fact from this study found that a change in RPMs from about 44 to 100, as in revolutions per minute, did not have any significant change on the motion of the joint, any of the joints studied, including the knee, which is the focus of our presentation. So now we can put these two things together to get to the meat and potatoes of the presentation, which is the muscle activity at the joint during the motion. So first we're going to look at the muscle activity at the extensors, and I'm going to just talk about the general trend with the data on the right before breaking down each muscle. So on the right you can see that with the extensors, they peak at usually the very start and the very end, with kind of a valley in the middle. Obviously there is some difference between them, which we'll get into. So on the x-axis we can see the degree indicating the pedal and where it is at each stage of its stroke. And on the y-axis, we can see the level of muscle activity throughout the motion. Generally speaking, breaking down both graphs, we can see that the rectus femoris has high peaks at each end, and the vastus medialis and the vastus lateralis each are similar looking in terms of muscle activity, with the high peak at the very start, low valley, and then it starts to increase again at the end of the rotation. Vastus intermedius looks a little different, with high peaks at both ends and then some spikes throughout the middle. A feature shared by all of these graphs is that each of them tail off before 180 degrees. And you would think with these being the extensors, they would stay active until 180 degrees while the leg is still extending, but the graphs don't indicate this. So a logical thing to ask was, well then what's happening? What is extending the leg throughout the remainder of that motion? And that is something that we can answer by actually looking at the flexors. Looking at the activity in the flexors, we begin to tell the whole story of how the leg is extending through 180 degrees and then being able to flex up back to zero. Looking at the graphs of the flexors, it's clear that they appear visually very different. For the extensors, they had two large peaks with valleys in the middle, where these have peaks and they're all seemingly pretty close to about 180 degrees. But if you think about it, they are turning on and having high muscle activity in areas where we would expect the extensors to still be the primary movers of the joint. We can see that these muscles do in fact help with flexion, but they also seem to help with extension also. This is clear after we understand the insertions of the hamstrings as they insert on the tibia. So activation right before 180 degrees actually helps move the tibia to straighten the leg, causing extension. Looking at both graphs together helps paint the full picture of the movement at the joint. With the extensors, they are active at the early stage up until about 90 degrees, where the flexors actually help take over, extending the knee, and then continue on through the flexing portion or the upstroke of the pedal. And then the extensors come into effect again after the fact when the leg is starting to extend to do another revolution. So seeing these together really helps to illustrate the entire motion and how muscle activation works together to produce the movement. As my research continued, it became more and more clear that the hamstrings and the quadriceps have a complex relationship. They work in interesting and unexpected ways to create synergy at the joint. Laying the graphs over top of one another, you can see how each muscle picks up where another will dip off, creating constant muscle activity throughout the motion. Anyone who wants to maximize performance should understand the relationship and how we create movement at the joint as to best avoid injuries. I've included my references, and I thank you for listening to my presentation.